Right now, India is in the middle of one of the oldest and deadliest public health battles of our time, the war on tuberculosis. And the latest global TB report, well, it tells a story of incredible progress, but also a monumental challenge. So, what's really going on? Let's dive in and break it all down.
So let's just start with this number because it really sets the scene for the scale of this fight. In 2024, India recorded 27.1 lakh cases of tuberculosis. That's the highest number ever diagnosed in a single year. Now that sounds alarming, right? But it's kind of a double-edged sword. It also means we're getting way better at finding patients who were, previously missed by the system.
But, and this is a big but, despite finding more cases, the WHO's latest report doesn't pull any punches. India has this super ambitious goal to eliminate TB by 2025. That's 5 years ahead of the rest of the world. But as you can see from this quote, the reality is we're nowhere close. And this gap between that ambition and the reality on the ground, that's really the core of what we're going to explore today.
Okay, so here's how we're going to break this all down for you. We'll kick things off with the latest WHO report card. Then we'll cover the basics of TB itself and dig into why it's still such a huge problem. After that, we'll look at India's national strategy, some incredible innovations happening right now, and finally, what the road to elimination really looks like.
All right, first up, the 2025 TB report card. And what it reveals is this central paradox. India is making these huge, impressive strides, but at the same time, the sheer scale of the problem is just staggering.
So, take a look at this. This chart really tells a story of success. Between 2015 and 2023, India managed to cut its TB incidence, that's the rate of new cases, by almost 18%. The global average, just 12%. That means India is literally reducing its TB burden almost twice as fast as the rest of the world. That's a massive achievement. But then you see this, and, well, here's the paradox we were talking about. Even with that amazing progress, in 2024, India still made up more than a quarter of all TB cases on the entire planet. 1 in 4. That makes India's fight absolutely critical for global health.
And behind all these stats, there's a really heavy human cost. The WHO estimates that in 2024, tuberculosis killed over 300,000 people in India. Globally, it's still the deadliest infectious disease out there, even more than COVID-19.
Let that sink in for a second. We're talking about a death from TB in India roughly every 2 or 3 minutes. A death from a disease that, for the most part, is completely curable. This is the tragic reality that's driving the urgency behind this whole elimination program. Okay, so to really get why this fight is so tough, we first have to understand the enemy itself. TB isn't some new virus, it's an ancient disease, and its biology is a huge reason why it's so incredibly hard to beat. So what is tuberculosis? At its simplest, it's a disease caused by a bacterium called Mycobacterium tuberculosis. Now, it can hit other parts of the body, like the spine or the brain, but its main target is the lungs. And that's the form that drives the epidemic, because that's the one that's infectious.
Now, how you get it is super important to understand. TB spreads through the air. When someone with active TB in their lungs coughs, sneezes, or even just talks, they release these tiny little droplets with the bacteria inside. It's not something you get from a handshake or sharing food. And because it's airborne, it absolutely thrives in crowded, poorly ventilated places, which is a key reason it persists.
This is a really key point. You've got 2 different states of TB infection. With latent TB, the bacteria's in your body, but your immune system has it locked down. It's basically sleeping. You have no symptoms, you can't spread it. But for about 5 to 10% of people, that bacteria can wake up later, causing active TB. And that's when you get sick, and that's when you become infectious.
Standard treatment for TB is about a 6-month course of antibiotics. Pretty effective, but here's where things get really, really scary. What happens when those drugs stop working? Well, that leads us to the growing threat of drug-resistant TB.
You see, drug resistance isn't just one thing. It's like a ladder of badness. It starts with MDR-TB, which is resistant to the 2 best drugs we have. Then it can climb up to XDR-TB, which beats even more drugs. And every single step up that ladder makes the treatment longer, way more toxic, and much less likely to actually work. So we know what TB is, but why is it still such a massive problem here in the 21st century? The answer isn't just about the bacteria itself. It's about the entire ecosystem, the social and systemic conditions where it lives and spreads. TB has always been called a disease of poverty, and for good reason. It just flourishes in overcrowded homes where the air doesn't circulate well. But in India, the single biggest driver, the thing that fuels the fire more than anything else,
is malnutrition. It's a vicious cycle. Being malnourished weakens your immune system, making you more likely to get active TB. And then, having active TB makes your malnutrition even worse.
And it's not just about social issues. There are real challenges within the healthcare system itself. When a diagnosis is delayed, that sick person just keeps spreading the disease for longer. And here's a huge one. Over half of all patients first go to a private doctor. Historically, getting those doctors to report cases and stick to standard treatments has been a massive, massive gap.
Okay, so that's the problem. It's huge, it's complex, but what is India doing about it? Let's talk about the counteroffensive, because India's fight against TB is this multi-decade effort that has really evolved to meet the challenge head-on.
You can actually see how the strategy has evolved over the decades. It started way back in 1962. Then in 97, they brought in the WHO's DOT strategy, where health workers literally watch patients take their medicine. A huge turning point was 2012, when every single doctor had to start reporting TB cases. And then in 2020, the language changed. It wasn't about control anymore, it was about elimination, a huge shift in ambition.
Today's game plan, the National Strategic Plan, is built on 4 really simple pillars. You can think of it as detect, treat, prevent, and build. First, detect. Find every single case out there as fast as you can. Second, treat. Give every patient the best possible care so they're cured. Third, prevent. Stop new infections from happening in the first place. And fourth, build. Make the whole health system stronger to support all this work. It's simple, but it covers everything.
Okay, this is where things get really cool. To actually win this thing, India is rolling out some incredible new tech and community strategies. These are really the weapons of the future, and they're being used right now.
First up, the diagnostic revolution. Forget the old, slow methods of looking through a microscope. We're now using rapid molecular tests. The star of the show is Truenat. It's a portable, Indian-made device that can diagnose TB and even check for drug resistance in under an hour. You can take it to the most remote villages. On top of that, there are now hundreds of AI-powered handheld X-ray machines out there, actively screening communities to find those missed cases.
And the next revolution? It's in treatment. And honestly, this is a total game changer for patients. Just look at the difference. The old way of treating drug-resistant TB was a brutal 2-year marathon with painful injections and awful side effects. The new BPaL regimen, it's an all-pill treatment that cures most of these tough cases in just 6 months. That is a monumental leap forward. And here's a pretty amazing fact. India isn't just using these new drugs. It's actually a key part of the global supply chain. One of the critical drugs in that BPaL regimen is called Pradhan. And right now, India is the world's only supplier. So the country is not just fighting its own battle, it's arming the world.
But look, tech alone can't win this war. You need people. You need the community. And recognizing this, the government launched a really powerful initiative. And that's where this number comes in. 1.6 lakh. That's how many volunteers have stepped up. So who are these people? They're called Ni-kshay Mitras, which means friends of TB patients. They can be individuals or companies or NGOs, and they adopt patients. They don't give them medicine, but they provide everything else. Food baskets, help with transport costs, even job training. It's a beautiful model of community solidarity.
And because we know just how critical nutrition is, the government itself is stepping up its financial support. They have a program that gives money directly to patients. And as you can see, they just doubled the amount, from 500 rupees a month to 1,000, just to help people afford better food while they're getting treated.
Okay, so let's pull all of this together for our final section. We've seen the data, the disease, the new strategies. So where does this all leave us? Let's take a really clear-eyed look at the road to elimination, weighing all that amazing progress against the hurdles that are still there. This table really nails that central paradox we've been talking about. Just look at India's numbers. We're reducing cases and deaths faster than the global average. Our treatment coverage is way better. On all these key metrics, India is outperforming the world. And yet, because we started with such an enormous number of cases, the absolute numbers of people getting sick and dying are still just devastatingly high.
So, what are the big roadblocks still in the way of elimination? Well, it boils down to a few critical challenges. First, there are still about a lakh missing cases, people who are sick but undiagnosed, spreading the disease. Second, getting the massive private sector to report every case properly is a huge logistical headache. Third, social stigma is still a huge problem, stopping people from getting help. And finally, there just aren't enough staff in key positions on the ground.
And you might be asking, okay, why does this matter on a global scale? Well, it's simple. The United Nations has a goal to end the TB epidemic worldwide by 2030. That goal is mathematically impossible unless India succeeds. With over a quarter of all the cases, the world is quite literally counting on India to win this fight. And that really leads us to the big, final question. We've seen the power of these incredible new drugs and new tests, but can India move beyond just a biomedical strategy to something truly holistic? An approach that attacks the root causes, poverty, malnutrition, and stigma, to finally, once and for all, break the chain of transmission for good.
Look, India's war on TB is an incredibly complex story, and it's far from over. If you want to dive deeper into all the data and the strategies we talked about, we've put together a full set of notes and a quick mind map to help you grasp all the key takeaways. You can find both of them by just clicking the link in the description below. Thanks so much for joining me.